There's a saying that we often say, youth are our future. And I guess I always add to it, our youth are our present as well. And they're ready to lead. They're ready to advocate for themselves.
A lot of negative emotions come from isolation. You do need some form of human connection. And whether that be through the online video games, talking to your friends, or going out for a walk, it is important. Meeting people where they're at, on their road that they're walking, it is one of the most important things to do, because if you are able to see the road that they're on and walk next to them on it, they will feel like they have somebody.
The toxic drug public health emergency is now entering its 10th year, and we know that what we are doing in the area of harm reduction is helping, but we also know that our youth population is particularly impacted. First Nations young people between the ages of 15 to 29 account for almost a third of all toxic drug poisoning events in this province.
I genuinely believe harm reduction does save lives. It helps lower the numbers of deaths and ODs that we go through, but it's not reaching enough people in order for it to actually have the impact we are looking for as the people who are trying to advocate for harm reduction.
Substance use disorder is a chronic, relapsing medical condition, and people who suffer from substance use disorder need the appropriate help. The other thing I think that's really important for people to know is that not all people impacted by the toxic drug crisis are people who suffer with substance use disorder. Even people who are experimenting or using it as a coping mechanism can be at risk.
I think more people need to focus on the destigmatization part, because yeah, we're doing a lot of work here on that end, but until we can get to a point where more people will see it as a good thing and not, all this negative energy around it, it will start moving in such a speed that we won't be able to keep up with it.
The people who are being affected by the toxic drug crisis are our neighbors, our leaders, our students. And I think it's important to know that anybody is at risk if they decide to access the unregulated supply of substances. We know in 2024 that the number of toxic drug crisis deaths and toxic drug crisis poisoning events for First Nations decreased provincially. And that shows us that what we're doing in the area of harm reduction is helping.
There's a lot of strength in taking the shame out of addiction, and putting harm reduction to work is telling your friends and telling other people, because your story holds a lot of value. I want to make sure that people know what they say is exactly what they're supposed to be saying, and if they're thinking it and they're saying it, it can almost become a reality. So if they're like, I want to become sober someday, but I don't know how to start, that is the start. You start when you realize that you have something going on.
The First Nations Health Authority has created the With Open Arms Supportive Conversations Among Friends Toolkit to help support youth and young adults to have the tools and resources they need for accessible information on substance use prevention, harm reduction, and holistic wellness. The FNHA aims to build on the momentum from the release of the toolkit by supporting youth-driven curriculum development and training to further equip youth and young adults to address substance use in ways that build strength and resilience, are culturally relevant and culturally safe, and support them to develop or access the harm reduction strategies, practices, and services that work for them. Some of the key goals for this project will be to build capacity among First Nations youth and young adults to continue to take on leadership roles in addressing the toxic drug emergency, produce curriculum and training resources to be used province-wide, establish pathways for integration into long-term services supported by FNHA and community partners, support youth and young adults to strengthen connections and promote healing through cultural activities, language revitalization, and traditional practices.
Culture is one of the biggest things in it. I've found it more as I walk this road, I guess. If I was fully enveloped in my culture, I might not have had time to do all the things I did. Hell, I might have not even thought of those things given the environment I would have been in instead.
I found myself believing that the ancestors, their prayers are still protecting you. That was my biggest awakening, to realize that like I've been prayed over and that the prayers are coming true, and a lot of things that I ask for in life, they come like right before my eyes.
First Nations harm reduction strategies are different from those in the mainstream. In our ways of being and knowing, we foster connection to culture, connection to community. And one of the phrases we use all the time is culture saves lives. And in this case, indeed it does. With the support of donors like you, we're hoping to ensure we can continue to honor the voices of First Nations youth, build on their resilience, and support initiatives that are responsive to their needs.